All right, it says we're recording, so I am going to jump right into our normal agenda and share my screen here. I did have an extra cup of coffee right before this meeting because I was like, I want to bring my A game this afternoon. Felt last week I was kind of like a B or C, so trying to step it up a little bit. So very normal agenda. And I have to give a shout out, as always, to the school nurses. I didn't even ask for our data this week. I kind of forgot. I usually ask for it Monday, and it was already in my inbox Tuesday morning. So thank you, Wendy and Megan, as always. And as you can see, we're just continuing this steep downward trajectory where we went from our biweekly case count went from 29 to 16. So we continue to go down even further into the green. Our student quarantines also took a huge drop as well, down from 52 to 31. Our staff quarantine, this orange line, down from 6 to 4. And then look at this, double zeros, our second week of 0 positive students. So that is definitely something to celebrate. Not only did we have 2 straight weeks of 0 positive students, we are officially in our second green week of on-site models. So although these are just advisory, it's still nice to be in the green. And then, man, test positivity rate down to 3.9. It just keeps going down, which we like to see. And with that, everyone's favorite part of the meeting, or no, everyone's favorite part of the meeting, Deputy Director Katie Plum from the Health Department, giving us some good updates, I think, today, Katie.
Yeah, I get to confirm everything that you just shared. That's the data. That's what we're looking at too, which is great news. Great news for schools. Great news for the community. We found out today officially that Crook County gets to move into the lower risk category, which we just skipped right over moderate, which is fantastic.
We don't need moderate. We go straight low. We're not messing around over here.
Yeah, cases and our test positivity, as you just saw, took a very steep downward trajectory. So we are really excited to be able to roll out the guidance that's associated with lower risk. And that also affects our extracurricular activities for the schools. So that's where it'll play into this conversation. And we're working closely with you all to just make sure that we make those adjustments and just know that it's good news. It's great news.
Katie, I bet you got a few phone calls from Rob Bonner this week.
Texts, email.
He's pretty excited.
He is. We are too. Well, we all are. It's good news.
Well, thank you for all your help with that. And now, also everyone's favorite part of the meeting, our school nurses. So we got Wendy Perrin, Megan McFetridge. You have any great insight to add, or any areas that we need to be watching in our schools?
Nothing really new. I just want to remind everybody we need to continue being vigilant, tracking those symptoms, keeping kids and adults out that are sick. So we need to keep up our fight so we can continue where we're at.
We've got a good streak going. Megan McFetridge, what do you got?
I don't have anything. I second what Wendy says.
It was that good. Yep. So we definitely, hey, we're at 2 straight weeks with 0 positive students. Let's keep that going. So definitely, I know this gets recorded and sent out to all our staff. So a big thank you to all our staff for continuing to stay vigilant with all those safety and precautionary measures. Katie Plum, did I cut you off? Did we have, were we going to talk about next, or like the next dates? You kind of had those in that document. Would that be interesting to share?
I do have, so our county risk levels stay, they are going a 2-week cycle. So just so we're reminded that this will go into effect on Friday. Yeah, and through the 25th. And so we'll do this process all over again. On the 23rd, we'll find out again where our numbers are at. And hopefully we can stay where we're at. This lower risk category is where we want to be. So I'll do another update to this document. We can send this out. Joel and Jason, I can get that document to you as well to send out so folks can see what the timing is of the data reporting and any changes that may happen. And then there's also a vaccine update attached to that just shows where we're at with vaccinating our priority populations right now, or our eligible folks. And that's really just as an FYI for people who are interested to see where we're at as a county, as a community, how many people around us are vaccinated, and how that's affecting our risk level too. Can be good to know and keep an eye on.
Katie, you guys are you kind of feeling we're just going to stay the course and continue to see things decreasing? Is there any like projections on the line or worries from the health department side?
I mean, we're definitely beating that same drum that Wendy just did with, staying the course, maintaining precautions. We're not out of the woods yet. We have a year's worth of data to work with. And so, we could potentially look at the trends from last spring going into the summer, and there may be some similarities, but there's also a lot of differences too with the vaccine being introduced. And it's a little bit of a moving target. We're definitely optimistic and just encouraging people to stay the course and stay on top of it.
Perfect. I just checked our anonymous complaint link, and believe it or not, another 0. So we have 0 anonymous safety complaints. So we must be doing something right. With that, it is 4:08. I think we got done at 4:09 last week. So someday we're going to look back and we're going to miss our Tuesday. Oh, Michelle Zissel said the coffee's working. That's right, Michelle. I'm going a little quick today. So yeah, someday we're going to look back and we're going to miss our Tuesday afternoon check-ins. But thank you guys all. Jason, I'll get you those handouts that Katie sent if you don't already have them, so we can send those out. And thank you everyone for their hard work. And we will see you all same place next week. Thanks, guys.